Hi, Osnat. How are you? How are you these days? Okay. It's things are starting to calm down a bit. We still have about 60 patients seriously ill. The disease is still with us. You have this constant pressure of shifts, which has increased even more in the past year. First of all, the staff is doing the best they can. We can't all do everything. You know, this isn't Scandinavia. People aren't always polite. If they were applauding us in the beginning, they're not applauding anymore. But maybe not from the balconies, but on the interpersonal level, not really. We've gone back to pretty much the way things were before, unfortunately. But one of the things we're constantly complaining about is the overload on the staff. That is impossible. It's in all the hospitals, in the clinics, the whole system. The world needs to understand that a great deal of money needs to be invested in the health system. Don't they understand that now? They not only do not understand, they say we've already given enough. You said you said we would have 2,000 people being ventilated, and we don't have 2,000 people ventilated. So you should give the money back. If it wasn't sad, it would be funny. I began my career as a volunteer in Mada in Jerusalem in the emergency services. That was the first a melting pot that I was exposed to. There were Arabs there, religious people, Haredim, secular people, volunteers. We were all there for the same goal. And the friendships that were created there showed that anything is possible. When we look at the interaction between the secular people and Haredim, there aren't too many places where they meet, and a hospital is one of them. They sit in the ER, and I always tell if it's in the pediatrics, first the curtain is closed, and then you open it, but you say keep an eye out, and then you open up the curtain and start talking. And when you start talking, then people don't hate anymore because you get to know one another and you see how people are. So a hospital is a very special place in that sense. And the medical teams also, the staff, everyone is from the same family, and you don't remember who is who. And the more diverse the population is, the better we become. Is it only apparently that we are? I'm talking in terms of the interpersonal relationships on the Stephen, certainly with the patients. What we want to encourage is involvement of the Arab population who are among our patients, also among fundraising. And we held a very large campaign at the beginning of the coronavirus, a very successful campaign. People rallied and we were able to acquire equipment for the hospital. And I got a WhatsApp message from an Arab gentleman from Ramle, Naif, and he wrote, I want to contribute a ventilator on WhatsApp. And it costs a lot. And I asked him, I was very moved. I said, that's very nice of you. And he said, that's the little that I can do. He was born in our hospital. His children were born in our hospital. So that's the first swallow. And that through that, we'll be able to see how we can do more. I was very, very moved by what happened. And he wrote it very beautifully. The good things are being done. We are here with 3 members of the health staff of Assaf HaRofeh Shamir Hospital. Beyond the technical issues, there are a lot of challenges in how to approach individuals. You don't always know their cultural background, and I imagine that this can lead to many, many challenges. We heard about one of the challenges that you are contending with. I remember once, I also studied here as a student in this hospital. I had a case where there was a person from a different background, not like me, and he spoke to the charge nurse and he said, there's an Arab fellow here and I really don't want him to take care of him. And if it was a young woman, I would understand, but I think that you have to be judged only professionally. I can give you other examples when we have a family in a difficult situation, a Muslim family, and because I'm familiar with the culture and I know how to relate to them. But sometimes when you see violence, there's nothing to be done. And that's at that stage. An example that occurs to me from about a half a year ago, a patient, I admitted a patient and I wanted to take blood tests. And she said, maybe somebody else should take the blood test. Did you ask why? Yes, of course. And she said, and I said, who? For example, there are two of us here, two nurses here. And she said, maybe Larissa. I heard there's a nurse named Larissa. Larissa? Do you know Larissa? Do you think because her name is Larissa, she's better than I am? And she said, no, because her name is Larissa. But I know that I'm offending you. Were you offended? No, I wasn't offended. I wasn't insulted. I didn't, I wasn't completely stunned. I said, yes, there's a nurse, Larissa, and I introduced myself and she knew my name. And I said, Larissa is taking care of someone else right now, and I can take care of you now as best I can, and I'll do the best I can. So I took her blood tests, and once when I was younger and trying very hard to succeed, and yes, I would have been offended there and I might have looked for another reason, but now I know the reason isn't me. And if so, it's just the way people look at it. During the Corona period, this was an extra boost of everything you knew, and you had to go full speed ahead. What did you discover about your profession and also about the populations that you are working with? I can tell you that, first of all, that we have a great strength of character in our profession. I don't think there is any other profession where people have to deal with such situations. And if we're talking about being for 8 hours wearing that spacesuit in the department, but ultimately we're able to do that restart and to come home. In your home, you have your partner and family, children waiting at home, and that's ultimately what we have to keep in mind. Our profession is a mission, and I can say that I personally, I know it's true for everyone else, I would never do anything else. I work in the Corona Department ICU, and I would say since December 2019 or January 2020, we've only been working on Corona. I can't remember not going around with this mask. Sometimes I forget to take it off. And we see people are tired, but it doesn't matter. They come to work. Why do they come to work? Because there's a goal. When you see a person whose situation is so difficult and then you manage to see him standing on his feet, it gives you so much. It tells you about the meaning of life. Life is different now. And this situation has given us a lot, and it's changed a lot in the way we see things. I think that in your specific job, when we're talking about the value of life, it is a very challenging period, and we've learned a great deal about ourselves as individuals and as a staff, and also how far and we can still do a lot of things and go home with a great deal of satisfaction. And if in the past we would say that the hospital is our second home, now it's our first home. So I guess we can say that it wasn't you who chose the profession chose you. I hope you have a little bit less work next year.